specimen collection kits. These are the swabs and the transport tubes that are used at the collection sites when a person has their nose swabbed or mouth swabbed. These are being sought by every state in the country. As you know, the states have been told that we are on our own in terms of finding this equipment, and so everyone is competing with each other, trying to find sources that can provide those materials. The governor's office has been extraordinarily helpful in putting together a group that is seeking to source those as well. We are routing our requests through the Emergency Management Agency and are using their contacts and their expertise to try to bring these to Alabama. So far, the lack of these screening materials like swabs have been the rate limiting step in terms of setting up the screening sites we have around the state. Still at this time, we have, I think, 17 screening sites set up as of today. Those are the ones that are connected to public health and the Alabama Hospital Association. We hope to have 25 sites fully functional by the end of the week. There are certainly others that are popping up associated with individual institutions as well. And so there are some in several other counties besides those that I mentioned. We know that 2 sites opened in Mobile County today. This was one of the counties that we had targeted as not having enough screening. There is a new site in Jefferson County today as well as others. We continue to remind the public that we do not need to test you if you do not have symptoms. This is extremely important. We have many people who want to be tested because they're concerned about being exposed or because they're wondering if they could have contracted something in the community. People who are not having symptoms do not need to be screened. There's no indication for that. It certainly uses up a lot of very valuable supplies. It makes it much more difficult for us to test those patients who are sick or in some cases acutely ill or hospitalized. It slows down the return on those test results for everyone. So please remember, if you think you might need to be screened, please pick up the phone, call your doctor, call the toll-free number that we provided for you before, and we'll send out again today to get more information about being screened. It's very important that if you're not symptomatic, that you do not attempt to be screened. We are going to issue additional guidance to healthcare providers in the state about who we would like to screen. Initially, if you remember, almost 3 weeks ago, we had screened only in accordance with CDC criteria, and it became clear that there was much more need for testing than that would allow. So we made testing available to any provider who wanted to request it for any patient. We still believe in trusting the provider's judgment, and yet we want to make sure that they're screening those patients a little more carefully before they submit test results. We're going to discuss that with our provider groups and consider issuing more guidance on that tomorrow. But generally speaking, we would like to test people who have symptoms and are either hospitalized, who are immunocompromised, or have other health conditions, who are over age 65, who are healthcare workers, who are in a long-term healthcare facility, and other types of patients can be considered on a case-by-case basis. But generally speaking, we only want those symptomatic patients that meet these high-risk criteria. Now, if patients need to be tested who don't meet those criteria, there are certainly other available testing pathways. There are commercial labs that are still available to clinicians who need to test patients who don't meet those criteria. But we're trying very hard to preserve our testing capacity for those people who most need it. You may remember last Thursday we issued health orders for the entire state related to the size of gatherings, as well as guidance around certain social distancing requirements. There have been additional health orders that were issued over the weekend in Jefferson County. Jefferson County has the highest number of cases. As you know, it's not clear if that's because there's just more testing available there or if there's more if there's actually more disease there. At this time, we don't have additional health orders that we're issuing at this time, but we continue to want to reinforce the orders that we have put out related to social distancing, as well as the other items that we discussed with you last week. So I have a handful of questions that were submitted. I'm just going to run down the list and answer a few of them. We do have some of you here in the room today. We appreciate your proper social distancing today, and we'll be glad to take live questions from all of you in just a minute. One question that's come up more than once is related to blood donations in view of COVID-19. At this time, there's no reason to avoid blood donation to the best of our knowledge. We do not have guidance that suggests that the disease is transmitted that way or is an issue. So we would remind people that blood donation is still very important. Our blood supply at any given time is fairly fragile because it relies on volunteers. There's no substitute for blood in many cases, and blood is a perishable product. And when people stop donating for any length of time, the supply dries up really quickly because there's always such a demand for blood. So we do not have any additional guidance about blood donations and would encourage people to still continue to do that. We get a number of questions about the site of screening tests, locations in different counties around the state. As I mentioned, we had at least 17 of those today, as well as the other pop-up sites that we may or may not always know about. We do not have the actual addresses of those on our website because there's some variability about when they may be open, what hours they may be open. In some cases, they may actually be mobile and might be at a different address. You can, however, obtain that information if your provider needs to have you screened simply by calling the number that the provider uses to arrange screening. So we can get that information for you with a phone call, but we simply don't have it posted because it is changing fairly rapidly and sometimes more than one time in a single day. We received a question about sewing masks or other masks that aren't the N95 respirator mask and how effective those are. There is absolutely no recommendation to use those for healthcare providers. They are not considered effective, and we would not recommend you using those. There is also no reason for healthy people to use those. There's no reason to think that they will protect you from a case of COVID-19, which can be transmitted through the airborne route. Only N95 respirators are effective for preventing that from preventing infection through an airborne route. There are some uses of these types of masks in a person who's known to be infected and who's coughing. If that person is being transported or is in public, then a mask will protect against splashes, against droplets. And so that mask can be used on a person who's known to have an infection. But otherwise, in spite of all the pictures you see all over the world of people using these masks, there's no evidence that those are effective, and we would not recommend that people use them. Let's see. Finally, I would say we do get a number of questions about hospitalized patients and how many they are. We have a way of sort of picking that up on the back end after doing our investigation. It looks like around 6 or 7% of our patients have been hospitalized, but we're still working to improve those numbers. We have some electronic methods of gathering data from hospitals that we have been putting into place, and so we hope that we will have more up-to-date numbers for you soon. There's certainly not a ventilator shortage at this time, but we are very concerned about the number of cases that hospitals have. Even without an absolute number shortage, some hospitals are already nearing capacity, and we've had to coordinate hospitals within the state so that they can share resources as needed. We also have a group that is looking for the possibility of additional ventilators that could come from out of state to add to our current supply. So while we do not have a shortage at this time, there are some facilities that feel a little pressed right now, and we're doing our best to work with the hospital association to address that. So those are most of the, I covered the majority, I think, of the submitted questions, and that's all the prepared comments I have, but be happy to take questions from those of you here in the room.
We heard from Mayor Walton Maddox over the weekend, who said 528 tests were spoiled or insufficient. Do you know how many other samples across the state have been deemed spoiled or insufficient, and can you explain how that ends up happening?
Sure. I don't know the exact number, but I know that's not the only group. That's certainly the largest group by far that were unsatisfactory. When specimens are submitted to the laboratory, they have to be collected and preserved and transported in a certain way so that the specimen remains viable. In the case of the Tuscaloosa specimens, the main problem had to do with refrigeration or lack of refrigeration. Those specimens were not stored and transported in a refrigerated environment, and it just made it unsatisfactory for testing. The results wouldn't have been valid had we run those samples. And so it was very unfortunate. This is a new test for everyone. We put out guidance to everyone on how to do this, and for whatever reason, those just weren't transported in the right way. So we certainly hope that that people understand how they need to be done so that we can test them.
Said some other groups that has happened as well. I mean, is this thousands combined that we could see in that?
No, I don't think thousands. I think any other group would have been less than that in total. But there, in any given submission, sometimes they're just not handled properly. Occasionally there can just be a reason that it's unsatisfactory because of other reasons too. Maybe it's not labeled appropriately and we don't know which patient it belonged to. Occasionally it's just, they're just issues with any type of process, I guess. But the main issue had been that one particular batch, and they just weren't refrigerated appropriately.
So going off of that question, would those people need to then be retested?
Yeah, we don't have any data to report on those people. So if their clinicians feel that they need to be retested, then they would have to submit another sample.
Also, you talked about at the beginning of your remarks, you said the state is increasing testing screening sites. Do you think the reason we're not seeing high numbers in some counties is because of the lack of testing opportunities?
Yeah, I think that's definitely true. There's no question that the sites with the most testing capability are the more populated counties, but also the counties that have the most screening that's going on. So we certainly understand that even though we have a system in which we try to be available to any person in any county and arrange testing, there's still a barrier for people in smaller counties, people who may have to travel to a site. Rural counties simply have less resources in many cases, or it may be more difficult for someone to connect with a provider. So we absolutely recognize those barriers and are trying to work around them and arrange our screening sites so that we can serve everyone. But there's still a shortfall that exists there.
What's the current testing backlog right now? How many tests are waiting to be processed right now?
The question is how many tests are waiting to be processed. I don't know the number. I would say that we are still telling people, approximately 72-hour turnaround. So it depends on a given day when they come in and how many are being run that day. But we generally are still trying to get things done in about 72 hours. We know the commercial labs are now reporting more than a week turnaround time for them. So that's the main reason that we're trying to find new testing facilities that can take that overflow.
I have some people that are confused about, there are so far 1,800 tests that have been completed. That does not include, is that for sure not include private companies? Because we have Highlands who reported that they did 1,000 tests. So, I mean, so how many more tests maybe have been completed?
Right. So we collect information from labs that test Alabama residents, and we get, by the emergency rule we established a couple of weeks ago, we get all positive results, and we also are supposed to get all tests, even if they are negative. So we're confident we're receiving all positive results. The number of negative tests that we're not getting, we think we are getting a lot of them, but at this time, I think it's just been an issue with those labs being able to electronically report. This is a test they haven't had to report to us before, and it just takes a little bit of time to get them up to speed on that. So I'm not positive we're capturing all the negative ones by far. Certainly that number would indicate that we're not getting all of them.
Can you talk about if there's any information that's being kept, any information that's tracking people that are getting better from the virus, to just kind of let our viewers know that, there is, I guess, hope instead of fear?
Sure. So the question has to do with those who may be recovering. I do not have specific data here in Alabama, although there is data available from other parts of the world. Remember, about 80% of people, or maybe even higher, 85% in some cases of people who get infected do not have serious illness, and they tend to recover within a few days and probably have some degree of immunity, although we don't know at this time if they have any long-lasting immunity, but they may have at least short-term immunity. We can hope that it will be longer. again, we believe most people would do well with this. There's a little bit of concern about what we've seen in Italy recently. As you know, Italy's been hit particularly hard, and Italy has had more deaths than any country in the world at this time, even more than in China. And so in Italy, a full 40% of the people who went into the hospital actually were young adults and middle-aged people, although, again, deaths are still much more common in the elderly population. But there is a group of younger people, younger and middle-aged people who are having fairly significant disease. But when people recover, they seem to recover fully.
You mentioned some numbers at the beginning of your remarks. You said that between the age range of 2 and 97 that have the virus in Alabama, and you also said the majority of them are males.
That's right. That's correct. Yeah. So the numbers that I gave earlier, it was about 53% male. I think the age range was about age 2 to age 97. The median actually was about age 44. And so, again, it's not necessarily what you would consider a truly random distribution. I'm not confident that that's actually accurate of all the cases in Alabama, given the relatively small numbers we have right now. But certainly, we know young adults and middle-aged people do get infected. We may not see them as often. We may not pick them up as often if they're not having a severe disease. And obviously, the seniors are the ones that have the most severe disease.
What would it take to issue a stay-at-home order? At what point would the state consider that, and are we close? I know Jefferson County has a little bit more stricter guidelines right now, but what would it take for either the state or Jefferson County to issue a stay-at-home order?
Yeah, the question has to do with a stay-at-home order. Obviously, that's something that would have to be done in conjunction with guidance from the governor's office and in consultation with the legislature. We certainly have public health recommendations. We can make it from time to time, and we have not made that recommendation at all. But public health orders obviously have a significant effect on people. It affects their lives. It affects their livelihoods. It's very difficult to know in real time with the information you have if you're strict enough or if you're too strict or if you have it just right. And honestly, time is going to tell us if we're right about that. But a stay-at-home order wouldn't be unilaterally issued by the health department, but only after consultation with a lot of others.
In your professional opinion, or the department's professional opinion, how many cases would we need to have? What would the community outbreak have to look like to even issue a stay-at-home order for any, maybe not even on a statewide level, but on
Yeah, sure. The question is how would a stay-at-home order, what criteria would be used? I don't think there's a specific trigger. I think we're monitoring the outbreak every day and looking at the number of new cases, but also the rate at which we get new cases. Certainly, some of the decisions that have been made in California or in New York have to do with outbreaks in healthcare institutions, for example, or exposure of really vulnerable populations. So I don't think there's a real clear criteria for that. There are just a lot of factors that would have to be taken into account.
You mentioned earlier that there were testing sites that your office or this department may be unaware of. Why is that?
It's because some hospitals, for example, may have their own testing supplies. They may have their swabs and transport media. They may have an arrangement with a private laboratory to do the testing. And we would eventually learn about those test results from the laboratory itself, but they don't need our authority or our permission to set those up. They're perfectly welcome to do those in their community, and we would encourage that. That increases the overall capacity and allows more people to be tested.
Can you speak about, the governor tweeted out that someone anonymously donated masks and other personal protection equipment. Can you speak about that?
Yeah, I'm aware of that as well. I don't know all of the details of that. I would say that healthcare facilities in particular are really pushing hard to find personal protective equipment. So we're very grateful for whatever person or organization made that available. We would certainly encourage those in the private sector who have access to that to think about donating that to your hospital to protect your healthcare providers. We know there are certain non-medical industries that can use, for example, respirators and as a normal course of business. And if people have additional supplies, we would encourage them to hook up with their local healthcare providers and hospital and consider making a donation. It is so vitally important to keep our healthcare capacity running fully, and we've seen in other countries like Italy in particular how infections among your healthcare staff can really devastate your ability to take care of people.
We've gotten a lot of these questions to the newsroom. People saying they have to come to work, and there are hundreds of people in whatever plant manufacturing building. How can they make us work when this is going on?
Yeah, so the question has to do with people in a work environment. We did not issue health orders related to work environments. We were speaking of social and recreational gatherings. However, that said, our guidance for workplaces is that they need to try to encourage social distancing as much as possible. It's very important for people to stay 6 feet apart if there's any way possible to do that. But we do not have any health orders related to work environments. So.
Dr. Harris, when it comes to employees at those sorts of workplaces, if they feel that they're being placed in danger or something is wrong with that, is there a way for those people to report their businesses for not following guidelines when it comes to distancing?
Yeah, there in the workplace, and then use what other avenues they may have when they have those issues. In some parts of the country, and even in Jefferson County, there have been health orders related to workplaces, but we have not adopted that statewide.
We've had a lot of people asking about daycares. Can you just give us a clarification? There are some daycares have emailed saying, they're confused that all schools have been mandated to close, but then now daycares are allowed to stay open. So what's the recommendation here? Not send your kid to daycare if you can avoid it. Maybe just clarify some of that.
Sure. So the question has to do with daycares. With daycares, we would prefer if people have the option to keep kids at home, if that's an option for them. I think any time that you have people gathered together, there's a greater risk for disease transmission. That said, we certainly understand the reality that many people have of having to use daycare. So our health order that we amended on Friday addressed the size of daycare to try to minimize the size of those classes as much as possible. Social distancing really probably isn't a practical suggestion in a daycare. Children aren't going to maintain a 6-foot distance from each other. I think that's really unlikely. And yet we would say that that's the ideal we would like people to strive for. It is very important to try to keep people apart, even if daycares may be necessary for a lot of folks.
Can you talk about why we haven't seen a lot of cases in the Mobile, Southeast Alabama area? I mean, you have a major international port there. You have cruise liners that are in and out. Also, people go there, it's a big tourism attraction spot.
Sure. So the question has to do with the relative lack of cases that have been diagnosed in Mobile. I think getting their testing capacity up to full speed is the reason we haven't seen cases. It's a big city, and it has all the features you mentioned that would make us suspect that there are cases going on there. So I think as the testing capacity increases there, we likely will pick up more. Not likely, we definitely will pick up more cases there.
In recent days, we've seen a growing number of state and federal lawmakers kind of questioning the effects of COVID-19 on communities. What would you say to these officials who are questioning whether the cure is worse than the disease?
The question has to do with, I guess, the economic impact or maybe social impacts of health orders related to social distancing. It's a very difficult balance. I think all of us come at it from a different perspective. In public health, we are doing our very best to make recommendations to protect the health and safety of our state. That's our mission, and that's our charge. And we have an organization that actually has a lot of great people who are very good at doing that. And at the same time, we understand that that's not the entire picture. It may be the most important thing, and yet it's not the only thing. And so we do have to work very closely with other leaders in our state to make sure that we are seriously considering the impact of any health orders that we issue. We spend a lot of time really agonizing, to be honest, over these issues because they really do affect people, and we get that. And so time will tell if we overreacted or if we didn't act soon enough or if we maybe got it right. But we certainly understand other people's concerns about the economy. I think it's clear from what's happening in the world, this has a dramatic impact on the economy. And what we hope to do is to break the transmission cycle and get this over as quickly as we can.
I know I've asked you this before, and a lot of people are still wondering this, and I know there's no crystal ball, but a lot of people are just wondering, when will we get back to that point of normalcy? For a lot of people, this is uncomfortable in how they interact with their fellow human beings. But are we looking at maybe extending this past that April 6th deadline, or are we moving closer to, ending it sooner?
Yeah, the question has to do with what's our timeline. Our health orders, as you know, had an expiration date, if you will, of April 5th. But as we told you last week, we'll evaluate each one of those orders before that time and give guidance to the governor and discuss with other folks and try to get input before we make a decision on whether to continue that. I would say Alabamians ought to be prepared that might happen, that they might be extended. But at this time, I think it's too early to say. It is hard on people. We are asking people to make a tremendous sacrifice, and social isolation is isolation. And as human beings, we don't like that very much. For people who aren't able to work right now, people in the food service industry, for example, those people are really hurting, and we get that, and we want them to get back to their normal lives as soon as we possibly can. So we're trying to use all the available information that we can to see what the course of this epidemic is going to look like in Alabama, and then we can make our recommendations at the right time.
I know you guys are constantly looking at this situation. I know it's constantly evolving, but at this point in time, how likely is it that schools will open up again April 6th?
Yeah, I'm not sure about the decision on schools. I have a meeting actually with Dr. Mackey and the education folks today, this afternoon, where we'll go through all the different scenarios and try to make our best guess. At this time, we really are forecasting a little bit and just trying to see into the future and figure out where we're going to be. But that decision has not been made, and I'm not sure we'll be able to make it right away. I think we'll wait a little closer to time to decide. So I've got time for a couple more. Then,
Dr. Ayers, when do you think, based on what you know, we can expect to see the virus peak in Alabama, and does that depend on people actually staying at home and social distancing?
Sure. The question is, when can we see this peak? And the answer is, it really depends on what Alabamians do. If Alabamians are willing to engage in social distancing, to avoid groups of people, to stay home when they're sick, to do all those hygiene things that we talk about, we'll get through this a lot sooner rather than later. Even if we do have cases that continue for a long time at a much lower rate, we'll actually be better off, because that'll preserve our healthcare capacity. That will allow less people to be sick at any one time, and there's just so many reasons that's a good thing. So we'll get through this at some point. We know we will, but the more people are able to cooperate with these recommendations to engage in social distancing, the better we'll be in the long run.
Can you get coronavirus again once you've already had it?
The question is, can you get reinfected? And the answer is, we don't know. There are other coronaviruses that cause common colds, for example, that people are able to get again. We do know that, but we just don't know about this one yet. So, okay, go ahead. Last question.
When it comes to nursing homes, healthcare facilities that receive supplies and equipment deliveries, how can they kind of reduce the spread of infection or potential with COVID-19, the virus, if they're delivering to these places that are already limiting visitation?
Sure. So the question has to do with nursing homes and their ability to control infections with deliveries, or with visitation, or with their staff, or whatever the case may be. Nursing homes actually do a really good job of handling infections. Infections are a threat for all, congregate living facilities, whether it's a nursing home or an assisted living facility, or a dormitory or a barracks, or anywhere you have lots of people gathered. Nursing homes spend a lot of time preparing for this and training their staff and trying to prevent this. And there can occasionally be outbreaks in nursing homes of certain illnesses like influenza. So this is not a new drill for them, and I think they've got a good plan in place and can handle that. All right. Well, listen, thank you very much for joining us today. We just wanted to take an opportunity just to answer some questions from the public. We'll try to do this again at a frequency that makes sense for you all. And thanks again for being here.